Welcome to the Living Kidney Donor video. This video will talk about the living kidney donation option and what to expect as a donor and recipient. Those with kidney failure have options such as different forms of dialysis and transplantation. Recipients of a transplanted kidney often have a better quality of life and live longer than those who stay on dialysis. A living donor kidney often lasts much longer than a kidney from a deceased donor. Living kidney donation involves transferring a healthy kidney from a donor to a recipient whose kidneys are failing. There are many ways to become a living kidney donor: direct donation, paired kidney exchange, or anonymous donation. Direct donations are often done between biological relatives or biologically unrelated people like a spouse or friend. Both the donor and recipient are tested to make sure their blood type and immune systems are compatible. These compatibility checks are done through blood tests. If you're healthy enough to donate but not compatible with your intended recipient, you can still donate into a paired kidney exchange or swap. This is when you donate to a compatible recipient and their donor, who is incompatible with them, then donates to your recipient. You can choose to anonymously donate a kidney as a gift to a person on the waiting list. A recipient will be chosen based on medical compatibility and priority, such as a child in need. Now that you've learned about the kidney donation options, let's talk about the procedure and what to expect after surgery. Kidney donation surgery is a minimally invasive procedure including surgical telescopes and a few small cuts. Multiple small incisions in your abdomen are made to insert surgical cameras and operating instruments. Your surgical team will start by moving the colon that is over the kidney to get a better view of the kidney. Next, the team will dissect the blood vessels from the kidney and the ureter, or urine tube, that goes from the kidney to the bladder. At some point during the procedure, a slightly larger incision will be made so that the surgeon can insert their sterile hand to help with the final steps of freeing the kidney. Once the kidney is removed from your body, it is given to the kidney recipient's surgeon, who prepares it for transplantation into the recipient. You will be placed under general anesthesia and receive a nerve block at the end of surgery for pain relief. Typically, the donor and recipient surgeries happen at the same time. While the recipient is getting their new kidney, your surgery will be finished. Occasionally, the two surgeries are done back-to-back in the same room instead of simultaneously. Afterwards, you will be taken to the post-anesthesia care unit or recovery room. Your transplant team will let your family know how you're doing. Your surgeon will come speak to your family as soon as your procedure is completed. Meanwhile, the recipient team will be completing that surgery. Most living kidney donors stay in the hospital for 1 to 2 days. At first, your pain is controlled with IV medication, but after some time you will switch to taking pills in preparation for going home. You can eat a liquid diet shortly after you return to the transplant unit, and your diet will be advanced as tolerated. Most patients are active and out of bed within a few hours of going back to the transplant unit. Your care team will check on you often and be there to answer any questions. Before being sent home, you will get post-surgery care instructions, such as how to care for your incision. Even though this procedure is minimally invasive, it comes with risks and potential side effects. There are both long-term and short-term risks linked to donating a kidney. Some of the risks may not be obvious. The short-term risks are mostly the risks from surgery and include things like pain, bleeding from the surgery, pneumonia, blood clots in your legs that can move to your lungs, injury to surrounding tissues or other organs when the kidney is taken out, infections in the wound or deeper near the kidney, risk from anesthesia, including heart problems, and death during the procedure. The long-term risks of donating a kidney are developing high blood pressure, a hernia through one of your port site incisions, or reduced kidney function. Even if reduced kidney function does not cause a problem for you, blood tests may still indicate a reduced measurement. You may be mislabeled as having reduced kidney function, which could lead to future problems with life or health insurance. Some patients may have risk factors that increase their chances of kidney failure. They may need a kidney transplant themselves. Previous donors who need a kidney transplant are given priority on the transplant waiting list. It is important to stay healthy. Do not take medication that can hurt your kidney after donation. Talk to your doctor or pharmacist before starting any new medicine, including over-the-counter medication. Your care team will follow you closely after your donation and see you back in the clinic periodically. Your blood pressure will be taken and blood and urine tests will be performed for kidney function at 6, 12, and 24 months. After that, it's recommended that you have your blood pressure checked every 6 months for life. And and have a urine and blood test for kidney function done once a year with your routine physical exam. There are also some psychological effects of organ donation, such as being worried about what might happen to your donated kidney and the recipient's body after transplantation, issues with body image due to scarring, and issues with health insurance in the future. Your care team will talk about all these potential concerns with you during the evaluation process. It can be hard to ask someone to donate a kidney, and it can be hard to decide to donate. Thank you for considering this path. There are a lot of things to think about, more than what can be covered in this video. For questions or more information, please talk to your transplant nurse coordinator at the University of Iowa Healthcare Organ Transplant Center. You can also review any of these excellent resources listed here. Thank you for watching.